Hello everyone and welcome to our webinar, which is going to talk to you about the recently published Uncharted Territory Review. I'm delighted to be joined today by Anne Hubbard, Director of the Wales Strategic Migration Partnership, by Hedwyn Daniel, who is working for Welsh Women's Aid and the Bevan Foundation, and by Amira Hassan, who is a co-author of the report, and by Wan Ji-Koo, who will hopefully join us shortly. So what we were planning to do today is just take you through a couple of presentations that firstly sets the scene and the background to the Uncharted Territory Review and gives you some context around what the first report published in 2013 told us and the recommendations. Then we'll quickly do a presentation on the new report and the findings of that, and then we'll have a panel discussion talking about what next as a result of what we have learnt. So with no further ado, I'd like to introduce Anne Hubbard, who will take us through the first presentation.
Thank you, Jo. Okay, Kunhanda, everyone, thank you for joining us. So, yes, I'm Anne Hubbard. I'm the manager of the Wales Strategic Migration Partnership for Asylum Seekers, Refugees and Migrants. Just talk to you a bit about our role. Can we have the next slide, please, Jo? So we are funded by the Home Office and based in the Welsh Local Government Association in Wales. We provide an advisory service on migration, influence in shaping policy and process, and we work with the Home Office, Welsh Government and a wide range of other organisations on migration. Thanks, Jo. We're working across a broad range of migration priorities at the moment, including refugee resettlement programmes, principally the Afghan resettlement programme, the National Transfer Scheme for Unaccompanied Asylum-Seeking Children, asylum dispersal. We've got recently recruited someone to lead on work to support the Hong Kong British national overseas visa holders who are arriving in the UK, and we also pick up on broader and wider migration issues. So this is just the cover of the report that I'm going to talk about briefly today to refresh people's memories or introduce people to it who haven't come across it before. So if you could go to the next slide, please, Jo. So I co-authored this report along with Amanda Robinson and Joe Payton from Cardiff University. It was published in 2013, launched in the Senedd by Lesley Griffiths, who was at that time the Minister for Local Government. And our aim with the research was to fill what we saw as a really big evidence gap about violence against women from asylum seeker, refugee and migrant communities in Wales. So we interviewed 55 respondents from right across Wales, 8 men, 45 women, about their attitudes towards violence against women and girls, the challenges they felt in accessing services and seeking their views on how services could be improved. Thank you, Jo. Yeah, that's just a picture of Lesley Griffiths, who launched the report in the Senedd. So what we found in the research report was a wide range of forms of abuse. You can see them all listed there, ranging from psychological abuse, intimate partner violence, so-called honour-based violence, FGM, financial abuse, elder abuse, and controlling and coercive behaviour. So what we found was that the abuse was predominantly by partners, but also a wide range of abuses within family and community. And what the report exposed, I suppose, or highlighted was how vulnerable migrant women with insecure immigration status particularly were to forms of exploitation and abuse. So we also documented the serious impacts on children within those contexts. Highlighted that it's true that according to the British Crime Survey, women suffer more serious, more frequent domestic assaults than men, but within that, asylum-seeking, refugee and migrant women face even higher levels of violence than native-born women. So a lot of the women talked, and the men actually talked to us about community pressures. They talked about the fact that if they seek help, it often means that they have to leave their family and friends and face isolation and stigma within their communities. The fact that honour is absolutely everything, and it means that women have to hide abuse. They told us that in several occasions that the religion respects women, it's the culture that lets them down, and the fact that women should talk to community leaders and imams. They also talked to us about solutions, and they were very clear that we need more men who explain to their brothers that violence against women and girls is not a no-no, that there should be a zero tolerance message within communities, and young people should most definitely be educated about conduct towards women. Again, you'll see here that women told us that religious leaders need to raise awareness that violence against women and girls will not be tolerated and is not based on or condoned by religious books. And we've got a very powerful quote there from one woman who said that she wanted to insist that established communities should break the cycle of abuse. You can make services available, but unless they change their views, there are invisible cultural boundaries. We've educated BAME communities about racism. Let's do the same about violence against women and girls. We have to make the effort, and men from those communities have to know it's not acceptable. Thank you, Chair. So one of the big focuses of the report was about the issue of no recourse to public funds, which continues to be, it was then and continues to be a major barrier to migrant women accessing support. There's a lack of knowledge, or was a lack of knowledge, about gender-based violence across public bodies, and Jo will talk about what the review has found in terms of progress on that particular issue, and also another finding was that many asylum seeker and migrant women face isolation in Wales and they lack access to services. The women told us that services need to focus on their needs rather than immigration status, and they also called for abuser programs which are accessible to people who don't speak English and are available in the community. We also made some recommendations for the police based on what the women and the men told us, and they felt very strongly that they wanted better engagement with police. So we suggested or recommended that there should be concerted, consistent and continued engagement so that police build and maintain relationships with the women from BME communities. We also recommended that police establish reference groups which are comprised of BAME women and led by female police officers. We also recommended, based on what the women told us, that social services should improve accessibility in relationships with women. And a big fear then, and I believe now, is the concern that if women report violence and abuse, they will fear deportation and having children taken into care. Other recommendations in the report were around funding for refugees and other spaces, which is needed to address the needs of women and children and protect their human rights, especially where they would otherwise be homeless. And we believe strongly that this would be a cost-effective solution when you weigh it against the wider costs of gender-based violence across the broader economy. And just to end by saying this is a very powerful message from one woman in particular, and we put this sort of right at the front of the report. So she told us that the conversation that we were having on that particular night was the tip of a very big iceberg. There are loads of people out there who can contribute to the discussion, put the message out there that this is going on, and the more people that come forward, the better things will be. Thank you very much.
Thank you very much, Anne. So that gives us a really excellent start in terms of our understanding of what the 2013 report told us and the findings of it. So I'm now going to move on to the findings of the Uncharted Territory Review. Slides. And this is going to be a double act between myself and Amira Hassami, who are we are co-authors of this review. So just to start with, by introducing myself, my name's Jo Hopkins, and I'm the Programme Director for Adverse Childhood Experiences, Criminal Justice and Violence Prevention at Public Health Wales. And the Adverse Childhood Experiences Support Hub, along with Public Health Wales, funded this review. And the reason that we had thought that this was something really important to do was that in thinking about the experience of COVID-19 in particular, we were concerned that there were marginalised groups who were further being marginalised while the pandemic was causing people to undergo restrictions and to stay in their own homes. And we were particularly concerned around people in the population who are more reliant on community and community-led services. And my background is 20 years in the Home Office, and I had the privilege to work with Anne and the others on that original report by supporting it from a Home Office perspective. And for many years, we've been very keen, all of us, to have a look and see what has happened as a result of that report. And it was a groundbreaking report and still is. There is not a similar one that has been done in the UK, as far as I'm aware, and it really does stand out in terms of the findings and the messages it gives us around this particular group. So I'm going to start just by telling you a little bit about how we have gone about the approach of this report. And what the basis for which we gather evidence and take forward our research in Public Health Wales and in the Support Hub is around using a public health approach. Now, there's lots of things that we could say about public health approach and lots of detail, but really for me, it is a very, very simple approach to take. The first one is thinking about how we define and monitor the problem. So what is the data that we need to systematically collect to determine who, what, where, when and how? And I think that data was certainly provided to us in terms of the original report, because Anne and the team were able to conduct focus groups and able to conduct interviews in a way that, unfortunately, with the review, that we were not able to do. It's also about thinking about what are those risk and protective factors, what are the causes and the correlates of the things that happen, the things that increase or decrease risk, and the factors that could be modified through interventions. So really with this review, we took the approach of trying to understand what are the things that might be the factors that would enable people to be able to access support, as well as looking at what are the things that are causing people to struggle to do so. And then it's about thinking about how we test and prevent prevention strategies, putting things in place, evaluating what's happened. So we see this review as a really key element of this, going back to the original findings of that 2013 report and asking the question, what has happened since, what progress has been made, and what more is there to do? And then we hope, as a result of this work, that we will be getting to the stage of step 4 of the public health approach, which is looking at what those factors are, what the outcomes are that we want to see, and thinking about how interventions and other methods might have been put in place and how cost effective they are. I don't think we're there yet with this work. I think we're still in the sort of step 2 to step 3 area, but I really hope with a gathering body of evidence and with people who are genuinely interested in taking forward what we found, that we'll get to a stage where we can start to really implement some things that will make a difference to people's lives. So now I'm going to hand over to Amira, as I said, co-author of this report, just to take us through the methodology and some of the literature that we looked at.
Thanks, Jo. So a mixed method approach to data collection was adopted in this review, including secondary quantitative data collection, semi-structured interviews with professionals, a review of the literature and policy documents. There was also invitations were sent to officials, in the Welsh Government, Home Office, the four police forces in Wales and local authorities to update against the recommendations of the original report in 2013. Also, with the help of Welsh Women's Aid and BOVZO, we've managed to document lived experiences of working with migrant refugees and asylum-seeking women and girls, especially during the COVID-19 pandemic. And if we move to our objectives, we really wanted to understand the extent of harm experienced by migrant, refugee and asylum seekers, women and girls, and highlight their vulnerabilities in relation to violence and the impact of current pandemic, including the impact on their mental health and well-being. We also wanted to review the progress made against the recommendation of the 2013 report, to highlight the progress that has been made, but also to identify areas where action still needs to be taken. We also wanted to identify any new recommendations as a result of our understanding, our increased understanding of experiences of these women during the pandemic, and the increased knowledge of the disproportionate impact COVID-19 had on BAME communities and people from more deprived areas in Wales. We also wanted to inform the action plan to address any concerns for Wales as part of the Welsh Government response to COVID-19 and the commitments of the Nation of Sanctuary plan, including specific links to the exacerbating factor of poverty, discrimination, and stigma around mental health. We finally also wanted to inform intervention and prevention action aimed at reducing the incidence of impact of violence for some of the most vulnerable people in our society. We wanted to do that through considering what works in supporting women and girls when there is need to be when there is a need to mitigate the effects of violence they have experienced. We also wanted to inform prevention and early help for communities who are less likely to access mainstream support or have access to online and digital services. Also to inform the policy recommendations to the Welsh Government, so there is the subgroup on children and young people, and the honour-based violence abuse leadership group in relation to FGM, forced marriage and the honour-based violence. Lastly, we wanted to provide policy recommendations to support the wider government and agency responses to safeguarding children and young people and adults in the pandemic, commissioning and funding decisions for specialist services in Wales, and to enable recovery plans to be put in place. The literature review really looked at the global overview of violence against women and girls, and we looked at the treaties and conventions in relation to violence against women and girls, and specifically asylum seekers and migrant women. Statistically speaking, globally, 35% of women worldwide have experienced either physical and or sexual intimate partner violence or non-partner sexual violence. 7% of women have been sexually assaulted by someone other than their partners. And globally, 38% of murders of women are committed by intimate partners. 200 million women have experienced FGM. And furthermore, it is estimated that 40.3 million people are enslaved, in which 71% are women. So despite all these efforts, gender-based violence still affects 1 in 3 women in their lifetime. We also looked at we've looked since 2013, and we've researched how much development in policy and legislation by both the UK and Welsh Government has progressed. So significant development happened. Legislations and law are now in place for England and Wales, including specific offences of stalking, forced marriages, and the landmark introduction of the human trafficking and domestic, the landmark bill of Modern Slavery Act was introduced. So a significant development was made throughout the years. However, still a lot of things needs to be done and changed.
Thank you, Amira. So what we did as well was think about not only the kind of landmark legislation that Amira's mentioned, but also since 2013, some of the larger pieces of legislation and policy that have been adopted in England and Wales, specifically around violence against women and girls. So the UK government have put in place a violence against women and girls strategy actually since 2010, but we've seen a refresh and a revision of that strategy. The most recent one is largely silent, actually, on the experience of migrant and refugee and asylum seeking women and girls. We've also had the Violence Against Women, Domestic Abuse and Sexual Violence Act, which was a Welsh Government Act, which is really groundbreaking and significant in the sense that we have Welsh legislation in Wales that should enable us to take forward work with across the devolved areas of government. And also in Wales, since 2013, we've had the development of the Nation of Sanctuary Plan, which is also a Welsh Government policy piece, which should also enable a connection between the experiences of people seeking sanctuary and those who've experienced violence against women and girls, domestic abuse and sexual violence. The Nation of Sanctuary Plan does include a section that makes reference to the work that was done in 2013 in terms of some of the recommendations and also provides some bridging between the two acts. There is an emerging picture. So not only have these pieces of legislation come in and policy, but there's also more work going on. So we know that currently the Welsh Government are refreshing the Valda SV strategy and working towards a blueprint approach for Valda SV in Wales with the police and criminal justice partners. And of course, we would hope that the Uncharted Territory Review and its findings and the 2013 report will be taken into account in terms of what that refresh may focus on for this particular group. There's also the Domestic Abuse Act, which will be is in UK legislation, and the forthcoming Nationality and Borders Bill. Those two, I think there's been a range of conversations around what's included and what is not included. So it remains really important that this report and others that focus on the experiences of migrant, refugee and asylum seeking women and girls is at the forefront of these discussions and policy negotiations around what these acts and bills might enable us to do. So as part of the Uncharted Territory Review, we were very pleased to be able to access some voices of lived experience through the tremendous support that we were given from Welsh Women's Aid and from BAWSO. It was very difficult to conduct the work as we would have liked to. We were restricted to having to do more of a desktop exercise than we would have hoped. Largely because at the time we were in probably the tightest period of the restrictions. And also there was a nervousness. We hadn't been able to necessarily communicate the aims of the report and engage with communities so that they understood exactly what it was that we were looking at. But it was really important that we were able to capture the actual experience of women and girls, and in particular when ringing helplines in order to try and access support. And it would be no surprise that in the case studies that we have included, the dominant kind of barrier and issue faced by women who had rung helplines asking for support, had identified that they were in an abusive relationship and trying to reach safety, met barriers related to no recourse to public funds. So here are some shorter clips of the case studies, which are obviously in full in the report. The first one gives really a kind of an understanding of how difficult it is to access refuge, but also that there are ways in which to do so, but it's just incredibly difficult and relies very much on the person who is is experiencing violence to take the responsibility for doing so. So here the case study explains that the lady later called back and informed me, the call handler, that she was unable to access refuge. When I explored this in more detail, it became apparent that she was on a spousal visa and had no recourse to public funds. I reassured her that there was help for her, and it was a matter of finding the right service for her. An advanced search identified refuges which would accept women with no recourse to public funds. She was going to self-refer again. She said she would call back if she was unsuccessful. Safety remains a priority at 999. So here we see that responsibility being placed on the woman to access support. The second case study also identifies some other barriers, not only the no recourse to public funds issue, but also barriers around language and language skills. So here we have a case where a refuge woman was not able to accept the female into refuge as she had no English language skills, and they would not be able to support her adequately. This was based on the experience of having previous cases last year where language barriers had impacted their services, and they'd had to write a policy stating females needed at least enough English to get through a risk assessment. They could also not support her due to having no recourse to public funds. I again mentioned the 2014 Act, but this was met with no reply. So here we have an example of a lack of understanding of how to interpret and use some of the legislation in this situation to support people. Almost, I think, as goes so far as to say, a discrimination in the sense that somebody who cannot speak English is therefore not able to access support, and the underlying issue around no recourse to public funds, of course. So this is multiple a disadvantage and somebody who clearly was not able to access the support they needed. It's not clear from the first one whether that person was able to successfully gain a place in refuge, but I think the stark reminder that the only other alternative was to remind that person that they needed to dial 999 really gives a sense that people, women and girls, have been left in abusive situations to almost fend for themselves. So what did this report achieve? Well, we went to, as Amira said, the main agencies who were recommended in the original report to take some action to improve what they do, their policies, their actions, and everything else that went with it. And we were very pleased to receive updates from the Home Office, from the Welsh Government, and from Welsh Women's Aid, very comprehensive updates that gave us an overview of how the recommendations had been taken forward and what each of those agencies felt they had done in order to make sure that they had met them. Unfortunately, we did not have a response from our local authorities and the social services departments or health or the police to the specific recommendations. I think this is something that we will continue to follow up with those areas, because I don't think this was a lack of willingness as such. I think it was impacted by time, by COVID, and by needing to document things that perhaps they would have needed to talk to a range of other people. So I'm going to be kind and generous and say that I think that we can still get a response from those areas. It would be really great to do so. Sorry, that's Winston, the dog, who's just seen someone at the door. We also have some really positive indications that the police will include the report in the work of the Policing Valder SV Task Force, which is sitting at the moment, and that is looking at thinking around how we can progress some of the criminal justice elements with some of the wider issues of Valder SV. So I think there again, we can see from the research that Amira's mentioned and the policy and the legislation, there's a really clear link between criminalisation of activity, what do we do with perpetrators and abusers who also may come from this group, and how are they, what is their experience of the criminal justice system, as well as the women and girls who are receiving and experiencing violence. So there's a really important opportunity here to tie up those recommendations that were made for the police around engagement with communities, building trust, and also the outcomes that people can expect as a result of that. And we've also been sharing the findings at a number of strategic groups that have been taking place across Wales, including stakeholder events in both the Welsh and UK government. So really great opportunities to talk about the experiences and to remind people that just because we haven't necessarily been out and about in the communities as much as we were previously, that these things are still going on. And actually, our concern is that without access to community-led support, which many of the women and girls within this group would rely on, then we have a concern that this experience of violence may also have been exacerbated. So we've been really positively received at the meetings and the events that we have spoken at, but obviously there is much more to do to convey the messages. So what did the Uncharted Territory Review actually find? I don't think these findings were at all a surprise to anybody who's been working in this field for any period of time. As I said, I'm really grateful for the updates from the Home Office, from the Welsh Government and from Welsh Women's Aid. But I think in terms of the Home Office and Welsh Government, there is so much more that wasn't said and could be included about areas that we still think really do need much more attention. So the findings were based really on what we felt was still missing in terms of the work that's gone on in response to the original recommendations. The first area which is highlighted, I think, specifically by the 2 case studies that were included, is that those who have no recourse to public funds, they're still falling through the cracks. The systems that they are trying to access, the support that they're trying to access, always comes down to the fact of what is the status and are they able to access funding. So there is still much more that we need to do to look at how, for this particular group, we need to overcome that barrier and to ensure that women are treated with humanity and access the support that we would expect any woman to be able to receive. We still don't know enough about what's happening in our communities, so there is still a question around data, and I think this is in 2 parts really. There is data collection and what do our systems record, how is it recorded, how is it interpreted. Well, we think that there's probably much more to do in this area and many other areas, but also how are our communities engaged with some of those conversations that we heard about and describing in particular around community leaders, around religious leaders, what the conversations happening and how can that be facilitated. It's no good me walking into a community and saying, I think you should do this. We really need to engage people from that community, understand their experience and think then collectively about what the right interventions might be to support women and girls who are experiencing violence. There are a number of agencies, as I mentioned, I won't labour the point, that haven't taken forward recommendations or at least haven't indicated how they were doing so. So we need to ensure that we are more inclusive now in getting a response from across the system, and probably some other areas that may not have also been included in that first report. So we now know, for example, that perhaps we ought to think more about children's services. We might want to think about more about wider community organisations that may not see themselves as VALDA SV groups, but might still be interacting with women and girls who have experienced abuse. And hopefully we can see if there are other routes to take forward recommendations. The findings also found, again, sadly, unsurprisingly, that migrant women and girls as a category are particularly invisible. There is more understanding, I think, of the potential experiences of refugees and asylum seekers, of violence perhaps before they've come to the UK, and the need for support there, but less understanding still about the experiences of women and girls who we would possibly identify, even if they don't identify as migrant women and girls. And I'm particularly thinking here as well about Gypsy Roma traveller communities who may or may not see themselves as migrants, but actually we have very little visibility of their experience. And then finally, there is still an ongoing lack of join-up. The research has found that, you know, even just through synthesising the updates from government, usually government is split into siloed policy areas. Those policy areas have updated on their bit, but we really need to see that more cross-government join-up, both within Welsh Government and UK Government, and actually between 2 governments or more governments, because this is about a global issue, as Amira set out. It cannot be just tackled by single agencies, single governments or single pieces of legislation. So that lack of join up is really hindering progress. And I think the no recourse to public funds element is a really strong example of that, where you've got immigration that is not devolved to the Welsh Government, but you've got the devolution of health and other services which need to be interacting with this group. So how do we get over those devolved, non-devolved legislative issues? The only way we can do that is by joining up better. So that concludes the two presentations. I hope that's given you a useful overview of what the original work found and what progress we've made in taking forward an understanding of the recommendations and what's happened. So now I'm going to invite our panel just to answer a few questions around these two reviews and what we think that might give us in terms of future direction. So if I can start with Amira. So the experience of COVID-19 has really affected all of our communities in Wales. And can you give us perhaps a little bit more about the particular experience of violence against migrant, refugee and asylum-seeking women and girls, and any examples of good practice that you might have identified as part of this work?
Thank you, Jo. Yes, so we all know that violence against women and girls was is a global pandemic, and it was labeled as so back in 2013 by the World Health Organization. And now with COVID-19, we're dealing with two pandemics, really. When COVID started, it hit hard the support service and the organization that supports violence against women and girls. It hit hard asylum seekers, migrants and refugees. It really exacerbated their vulnerabilities in relation to accessing the support services available. The introduction of measures to stay home and work from home really took away that element of face-to-face interaction for women who are suffering from violence, especially asylum seekers and migrants and refugees. Financial means, if we talk overall, how much the asylum seeker gets a week, and the prices of products, especially in the small shops, if we say the cultural shops, the asylum seekers and refugee shop in, were high in prices, having to spend more in hygiene products. At the start of the pandemic, there was mixed messages. They didn't really know where to go, what to do. The money wasn't enough. It means as well that they were trapped in their abusive relationship. For furthermore, some women really reported that they feel they were still, living with their violence partner, even though they've left, just because of the idea that they cannot go out and see people and interact with others. I think one of the best practices that I would say is when we were allowed to go out in small groups. Some of the organizations that I worked with here in Cardiff, they've introduced the walking groups to go out with survivors and victims of violence against women and girls, to walk with them and try to build that relationship after it was taken away from them. They really appreciated it, and they felt, even though it was a small step, they felt like it was the whole world to them. I think a headwind maybe from the Welsh Women Aid perspective and the survivor engagement would be able to inform more on this. But from my perspective, yes, it hit hard, really, the support services and the safety net for most of these people.
Thank you, Amira. So seamlessly moving to Hedwyn. I don't know if you wanted to add anything to what Amira said, but also to say that thank you for the case studies that we were able to include in the review. I think they really brought it to life. They were so powerful and really demonstrating those barriers that women and girls face in accessing support in particular. Would you think there is one that stands out, or maybe more than one that stands out for you as perhaps the thing that needs to be done or changed to make a difference to the lives of women and girls in this position?
Well, thanks. Yeah, thanks, Joe. Thanks, Marie. I would like to say, just on the issue of language and sort of discriminating against people on the basis of their level of English. Well, there are interpretation services out there, and we just wouldn't, under any circumstance, expect that anybody would be turned away on that basis. But similarly, with no recourse to public funds, and I think that's what I'll just zone in on for a moment, if that's okay, because for the benefit of some listeners who maybe aren't familiar with the term no recourse to public funds, or the sort of interplay between immigration status and access to support services, you might be thinking, well, what? These services should be free of charge. You surely don't have to pay in order to get into a safe place. So I just thought I'd just clarify a little bit around that and how that works, what the actual issue is there. So obviously women from migrant backgrounds, as we've already heard, who have insecure status, or perhaps they don't know their immigration status, they do face multiple barriers in various different forms when trying to get support. But the one I want to explain then is that there are two particular factors relating to immigration status and access to services, which when they come together, they make it really difficult, almost impossible for anybody with temporary immigration status or insecure immigration status to access refuge, or for that matter, any kind of accommodation and support for really basic needs when they're fleeing abuse. And so these two factors are, so one, as we've heard, is no recourse to public funds. And essentially, when somebody applies for time-limited permission to stay in the UK, normally the Home Office will apply a condition to this visa that says no recourse to public funds, and that just basically means you have no right to access most of the mainstream welfare benefits like universal credit, housing benefits, and a whole range of other public funds. So that's the first factor. And then the second factor is refuges, as well as a lot of other specialist support for survivors. They're largely funded by these public funds. So refuge rent, for example, is normally funded through a survivor's housing benefit. But obviously, if you don't have access to housing benefit, then how does that work? So when these two factors come together, it means that a service that a survivor needs to access can't actually cover the costs of supporting that survivor. And so in practice, what that means is that survivors are often turned away on the basis of their immigration status, unless they get funded through some other means. So for example, through social services, or the refuge might have some reserves, or they might have some designated funding specifically for this purpose. So in the question, you sort of asked me to prepare, asking what, is there one thing that really needs to be prioritized, or is there one thing that must be done to make a difference to the situation and to the lives of these women and girls? So I'd suggest 3 ideas, if I may, and I will be quick, but only looking at this funding barrier. So we've already mentioned there are lots of other barriers, but just looking at this funding barrier in particular. So the first suggestion is aimed at the Home Office, and the second at social services departments, and the third at the Welsh Government. So first, I would just repeat what specialist services for Black and minoritized survivors have been campaigning for years and years, which is for the Home Office to just amend the immigration rules to make sure that all survivors of abuse can access mainstream welfare benefits when they need them. So the Home Office already has made this a possibility for some survivors of domestic abuse through something that's called the Destitution Domestic Violence Concession. But the eligibility for this concession is really, really limited. So amending this concession so that it's open to all survivors of domestic abuse, regardless of their visa type or immigration status, that would, help to solve this problem. But as I said, people have been campaigning for this for years and still no movement in that regard. So the second sort of recommendation or potential solution I'd like to propose is that, so I've already alluded to the fact that social services could be enabling survivors to get specialist support through actually funding refuge placement, for example. And in Wales, there is actually a legal duty on social services to meet the care and support needs of adults as well as of children if it's necessary to prevent abuse or neglect. So unlike over the border in England, where in relation to adults, their needs have to arise from sort of a specific additional vulnerability like mental ill health or lack of capacity, disability, etc. This isn't the case in Wales. So in Wales, a risk of abuse can be sufficient to trigger this social services duty. I mean, there are some exceptions around immigration status, but they are very limited. And even then, there are some provisions around human rights breaches and things like that, which we definitely don't have time to get into. But nevertheless, what we continue to hear from our member services, from Bowser, from elsewhere, is that social services often don't implement this duty, and we've come across a huge lack of awareness and understanding of the differences between the legislation in Wales and in England. So I think supporting social services to increase the rate at which they implement the duties would be another solution. And then finally, if I may, the Welsh Government. We know immigration policy, isn't a devolved area of policy, but the Welsh Government really must use the powers that are devolved to Wales to the greatest extent possible to make sure that these services, life-saving in some cases, are accessible to everybody. And so under the Violence Against Women, Domestic Abuse and Sexual Violence Act that you referred to earlier, Welsh ministers have a duty to take all reasonable steps to ensure that there is equal access to services. And so in our view, providing ring-fenced funding for specialist services to access as and when a survivor with no recourse to public funds needs that support would really help to make sure that no survivor is turned away from this essential support and potential life-saving support on the basis of immigration status, language abilities, or whatever else it may be.
Thank you, Hedwyn. I was expecting a comprehensive answer, so that's brilliant. Thank you very much indeed. So turning to you, Anne, in terms of, and I know that you've been heavily involved as well in the no recourse to public funds discussions and networks over the years. And obviously, you know, the review that we've done now has highlighted some progress as we've talked about, but also that there is so much more to do in terms of not only preventing this form of violence, but actually supporting women who've experienced it in Wales. And in your role as director of the Wales Strategic Migration Partnership, where do we go from here? And what do you think that the Migration Partnership might be able to do to support whatever you think we need to do next?
Well, that's a big question, Jo. Where do we go from here? I mean, today's the start, and I want to thank you and Amira and Hedwyn for doing the review and raising awareness of it. We're really, really grateful because despite some of the progress that you've outlined in legislation and policy over recent years, I think the reality is for women and girls on the ground, they've yet to see, or many of them have yet to see, any difference in their lives. So that's why we need to continue to raise awareness of the original findings. In terms of the WSMP, we will continue to raise awareness, and where possible, Jo, to provide a platform for you to share, and Amira to share review findings. Jo and I looked at a couple of opportunities in the new year. So we really, really want to raise the awareness and keep it there going forward. Yes, we need to consider the implications of a nationality and borders bill and what impacts that's going to have on what we're trying to achieve. I mean, more specifically, we will continue our work with frontline practitioners to make sure, sort of working on a multi-agency basis, that women and girls within the asylum and the immigration system are adequately safeguarded and supported, and there's real complexities around that, particularly as Amira, as you highlighted, within the context of the sort of ongoing pandemic. Jo would very much welcome ongoing work with you, in particular on getting a response from the police and social services. I know you've made some progress in terms of police. I think hopefully we're in a position to do more, I believe, with social services. So let's make that a real priority for the coming weeks. So yeah, in general terms, want to work very much with all of you here and the sector in driving forward the change that is required. But there's no silver bullet, I'm afraid. It's just about us continuing to do what we're doing and grasping the opportunities, particularly in the devolved context, to achieve some of the changes that we'd like to see.
Thank you, Anne. And I think To end on hopefully a positive note in terms of there are conversations taking place, both in the Wales context, but also in the UK context. I know the Domestic Abuse Commissioner has been very interested in understanding more about no recourse to public funds and how that impacts women. And I think, you know, there are opportunities that come about from the refresh of the strategy that we mentioned, and trying to link better with the opportunity of Wales in having a nation of sanctuary plan and having that legislation, which is something that the other nations of the UK don't have. So I'm optimistic that we can keep going. I'm delighted that we were able to kind of take another step forward, although it feels like a small one, but I think it's an important one. So just before we close, just like to ask Amira if there's anything that you wanted to say as a final thought, really, in terms of, is there a message that you can give us in terms of hope, I guess, that there is an opportunity to engage with communities and that we can do more?
Yes, there's always an opportunity. I mean, starting here is a good step, and if we take things further, as Anne said, and we follow up with all the recommendations and the updates, I think we would get into a very good place where we can you know, feel comfortable in sharing our findings and engaging people to come on board with us as well. It is a really good start, and we are in a good place. And moving forward, I can see I'm very optimistic. Things will change hopefully to the best.
Great. And Hedwyn, do you share that optimism, or do you think that there are further things that we might need to be thinking about?
I'm optimistic. I'm always optimistic, but I think there really is a sense, and I believe if Wanjiku had been able to make it today, unfortunately not, I believe she might have communicated some of that frustration around the fact that here we are, still here, still basically facing exactly the same barriers as were highlighted back in 2013 and even going back before then. So yes, optimistic. I think people who need to be listening are beginning to listen, which is good. But yes, moving this from this discussion into concrete actions would be a lovely next step.
Great. Well, I think that's our call to action, isn't it? Is to let's make this into something that we can take forward into the, you know, with the levers we've got and with the discussions that we've been having, and turn it into some concrete actions that make a difference for women's lives. So thank you all very much for joining me today. I hope that people who will view this will have enjoyed the presentations, have understood more about the work that we've been trying to do, and will join us in trying to take forward these actions and make a real difference to migrant, refugee and asylum seeking women and girls' lives. So thanks to you all, and we'll keep talking. Thanks very much.
Definitely. Thank you, Jo. Thanks everyone. Bye.